Assalamualaikum. Today I'll discuss about colorectal carcinoma. It is the second most metastasis cancer all over the world. I'll discuss about the pathogenesis. Pathogenesis of colorectal carcinoma is divided into two. One is dietary risk factor. Another is single gene mutation. It is divided into two, sporadic and another is genetic predisposition. This is inherited colorectal carcinoma. It is divided into two, without polyposis with polyposis. H for hereditary, N for non, P for polyposis, colorectal carcinoma. With polyposis there is a MAP, family adenomatous polyposis, PJCJPC. Now I'll discuss about the this is a I draw a large curve in ascending colon. There is a 50% chance of, in ascending colon is a 50% occurrence of colorectal carcinoma. 25% actually. This is 50%, this is 5%. But in rectum and sigmoid colon, most common common site of cancer is rectosigmoid. 65% cases, most common site. Most common site is rectosigmoid. Now it can spread by three ways. One is lymphatic, another is blood, third is translomic. Then I will discuss about the clinical feature. Fresh rectal bleeding if in left side, if it affect left side. Then anemia with occult blood. Third is colicky, abdominal pain. If any cancer occurs, then weight loss may be found. Another is obstruction, perforation, peritonitis. Now what is the investigation? Colonoscopy is the colonoscopy is the most colonoscopy is the most investigation of choice. You can go with ultrasonogram, CT scan. of abdomen, then sigmoidoscopy. Now I will tell you what is the dietary risk factor. Dietary risk factor. Dietary risk factor is red meat. You can find carcinogen amines. Another is saturated animal fat. Saturated animal fat. Saturated animal fat. Colorectal carcinoma. Now pathogenesis, most common site, then investigation, dietary risk, clinical feature. Now treatment is surgery. Second is adjuvant therapy. Third is palliative. 5 fluorouracil is a drug of choice. You can go if you do surgery, then you should at first do chemotherapy. If you go with adjuvant therapy, then surgery and chemotherapy. 5 fluorouracil, and then you can go palliative. Now I'll tell you the whole information once more. Colorectal carcinoma is the second most popular cancer all over the world. Pathogenesis, dietary risk factor, sporadic genetic single gene mutation. Without polyposis, there is a hereditary non-polyposis colorectal carcinoma. With polyposis, FAP, familial polyposis. Then investigation is colonoscopy. Dietary risk factor is red meat and saturated fatty acid. Clinical feature is fresh parectal bleeding, anemia plus occult blood, colicky, abdominal pain, weight loss, obstruction, perforation, peritonitis. This cancer may spread through lymphatics, blood, transilluminate. Most common site is rectosigmoid.